Aloha and welcome to Hawaii Together on the ThinkTech Hawaii Broadcast Network. I'm your host, Keli'i Akina, president of the Grassroots Institute of Hawaii. Our topic today is tax hikes could worsen the doctor shortage in Hawaii. Do you realize that the Hawaii State Senate almost unanimously just passed SB 56, which would raise Hawaii's income tax to 16%, up from 11% on anyone making $200,000 or more? And that would give us the highest income tax in the nation. Now, the bill would also hike the capital gains tax, conveyance taxes, and eliminate several general excise tax exemptions. It's a real whopper. In fact, one tax analyst called it the Enola Gay of tax increases. Now, the measure still needs to be heard by the State House, but many professionals, including doctors, are concerned that a steep tax could push doctors out of the state. I've got today with me a couple of people who really know what they're talking about and understand the medical profession. Lisa Rantz is the president of the Hawaii State Rural Health Association and the executive director of the Hilo Medical Center Foundation. Lisa, I'm glad you're on our program today. Welcome today.
Thank you. I appreciate you having me here today.
How's the weather over there in Hilo?
Well, it's been quite rainy, a little soggy. I don't think that we got the worst of it this time around, thank goodness. We usually get the worst of it. But it's sunny right now, so looking forward to that continuing.
Well, the weather is a little less stormy than the tax climate if our legislature has its way. I also have with me Dr. John Wade. He's a radiologist in Hilo, and he's a member of the Hawaii Physician Shortage Crisis Task Force. John, welcome to the program.
Thank you for this opportunity to join you today.
Well, we're looking forward to your expertise. Now, Lisa, in your work with doctors in the Hawaii State Rural Health Association and the Hilo Medical Center Foundation, what exactly do you do and how do you serve the profession and ultimately patients in the Hilo and Big Island area?
Well, thank you for asking that. So in my capacity, I'm not a clinician. However, I support clinicians, and as the Area Health Education Center for Hawaii Island, that's federal monies that come in to support workforce pipeline activities. So we recruit folks into health careers, help people transitioning from one career to a health career, and then we track it. So we, are trying to work on the shortage. One of the things that we worked on out of our office was getting a health profession shortage area designation, or a HPSA, and that qualifies our physicians and other providers for loan repayment, which is huge because when they come out of school, they're averaging about $250,000 in debt. So you marry that with our lower reimbursement rates for insurance and the higher cost of living, and you kind of have a perfect storm. So what we work on is getting the federal infrastructure along with working with our state legislature to get things like preceptor tax credits, and we're working on an exemption from the GET tax also for our private practice providers. Right now, hospitals have that, and without it, they would probably go out of business, and they've told us as much. So it's really important to really help our solo and small practice docs to be able to survive in this climate.
Well, thanks. Speaking of which, I want to switch to John and ask him exactly how he does survive in the rural environment of Hilo and the Big Island, and what motivated you, and tell us a little bit about the work of the Hawaii Physician Shortage Crisis Task Force.
Thank you. I actually came to Hawaii about 2 years ago, and I've since then become very active in looking at what ails Hawaii healthcare. You start with the shortage itself, which is well known and well documented. The state legislature has funded a study on an annual basis now for 12 or 13 years. And we have excellent documentation of a shortage that is mounted on the Big Island from approximately 10% to, at the end of 2020, the Big Island physician shortage mounted to near 53%. And so when one asks how physicians are surviving on the Big Island, these shortages are something that we live every day. There are certain specialties that are simply missing. There are certain specialties of which we just simply do not have an adequate number of physicians in those specialties. And what this results in is, significant negative impact on patients' access to healthcare. What we've determined is that there's a significant difference between having access to a payment plan, which in Hawaii is nearly universal, and access to an actual provider or deliverer of healthcare, which is what real access is. In point of fact, if you can have a healthcare plan in place, your family can be covered. But if there's not a healthcare provider that you can see, those plans are meaningless. And so we cannot equate those two very basic fundamental issues. We can't equate them because they're very, very different. They're very, very different measurables.
Well, that's a very interesting point you bring up, the difference between having nearly universal health care coverage and actual access to health care. Oh, what is really at the root of this? Why is it that we can't attract the kinds of medical providers that are needed on the neighbor islands or even throughout the state? Why do people have to wait forever, it seems, to get specialists if they are on the neighbor island, or they'll have to fly to Oahu or the mainland? What's at the root cause of our doctor shortage?
Well, first off, I think we need to understand how large the shortage is. And I think that this is simply not, well known. And certainly within the legislature, there's been a failure to acknowledge the size of the problem. And if you fail to acknowledge the size of the problem, then you will inevitably fail to address the problem or seek answers. Currently, the state of Hawaii is missing in excess of 1,014 physicians. And those shortages are greater in terms of percentage on the neighbor islands, although greater in absolute numbers on Oahu. Shortages measure 53% on the Big Island and 43% on Maui. That shortage is 20% on Oahu. But during the last year, all of those shortages in the year of COVID increased by nearly 15 to 20% on each and every island. So the task force is starting with that basic fundamental fact that's measured on an annual basis by the state. And then we're trying to go back and determine exactly why those shortages are in place. I largely believe that there's a unique set of circumstances on the islands which have resulted in this. One is how we administer the general excise tax in the state of Hawaii. This is a tax that within the healthcare field is applied to the general revenue number of a practice. Unfortunately, unlike many other businesses, a lot of these charges cannot be forwarded to the patient. So it doesn't, in the healthcare community, act like a sales tax. It acts much more like an income tax and has a tremendously disproportionate effect on bottom line revenue of private practices in the state. This also puts private practices at a competitive disadvantage with some of the non-for-profits and with the hospitals who are not subject to the GET tax. So what we end up having is that 4.5% of gross revenue. When you look at its bottom line effect on net revenue, it's actually closer to 15 or 20% effect on net physician income. And this is unfortunately a taxing mechanism that's fairly unique to the state of Hawaii. It's grown out of nearly 100 years of tax history, and we're now really facing the unintended consequences of that structural tax system that was put in place nearly 100 years ago. The second,
Let me stop you right there because that's worth digging into just a little bit more. You are right that it is a fairly unique situation in Hawaii. Across the nation, most states do not allow for the GET tax health medical and food, but it affects us tremendously here in the state. And we've known for a long time that it's a regressive tax on the poor. But you're pointing out something I don't think a lot of people, and I don't think our legislators really understand, and that is that it actually hurts the ability of a private practice doctor to stay in business. That suggests to me that the margins that are being made by these doctors financially are pretty slim if the GET cuts into it so significantly. Is that right?
That is absolutely true. Most small medical practices have very slim margins because they have very significant overhead, meaning there's staffing costs, there's structural costs related to maintaining a building, there's equipment costs. And those things in combination tend to consume a very large percentage of the practice's revenue. Therefore, the GET tax has a disproportionate effect on businesses with that degree of overhead, because essentially what's happening is that you might have a business that brings in a fairly significant number of dollars, and that relatively low 4.5% GET tax, so, is applied on that big gross revenue number. So the first thing that happens to every single private practice in the state is that 4.5% is carved right off the top. And one has to understand also is that payment programs like Medicare are not designed to take that tax structure into account. The federal government does not care that the state of Hawaii carves off 4.5%. That 4.5% tax is not built into Medicare payments. As such, when one looks at the math, the state of Hawaii, after you apply GET tax, has the worst Medicare reimbursement in the country.
Now, this is something that Lisa is terribly concerned about and has been advocating in regard to, and that is the reimbursement rates of Medicare and their impact upon doctors. I wonder if you could share some insights into that, Lisa.
Exactly. So as Dr. Wade was referring to, in other businesses, you can pass on that increase that you get from taxes. If you go to the grocery store and you're buying produce, the supermarket can pass that along to you. In medical, your reimbursement rate is what it is. That's not increasing. So then your insurance payments aren't increasing, and then it's illegal to pass on that Medicare expense. So you can't not pass that tax on to Medicare patients. So that's prohibited by the federal government. So, it becomes saddling to our physicians and to the small practices because they're not receiving the enhanced reimbursement rates, like say Alaska, who gets a 1.5 differential on their Medicare rates, which is something we're in conversation with our congressional delegation about. Is, we're not only rural, but we're remote. So, some of these benefits that come to some of the frontier areas, we're looking to see if we can get here to help with our shortages, because it just doesn't work. So you can't keep increasing prices and not be able to pass that cost along, which our providers are not allowed to do.
Now, we're not just talking about the profit margins for physicians or for medical services. We're ultimately talking about the supply of medical care for the public, and that's really ultimately the bottom line. That's where people get hurt the most. So, Lisa, in a sense, you're saying that Medicare is, ironically, making medical provision less available to the general public than it should be.
Well, I think access to care has always been an issue. I get calls on a regular basis of our community members looking to get in with a medical provider because they're either not accepting patients or they can only accept, they have to cherry pick patients. I'll be quite frank with you. They may say that they don't, but they have to, just out of the need to self-preservate, right? So they can't we have a lot of high chronic patients with multiple conditions, but they don't have social workers in their office. They can't manage all of those high cost, high needs patients. They need to take patients that have private pay, right? They take private pay patients, they take commercial patients. They can't afford to have a panel that is entirely Medicare or Medicaid because the reimbursement rates aren't high enough to cover the overhead, which is a fixed cost. They also have the fixed cost of their staff that they have to pay for as well. So it's not just that, doctors make a lot of money, and oh boo-hoo, we're crying over a tax for them. This really boils down to an access to care issue for our community members.
Definitely. Well, our time is going by so quickly. We're going to have to take a quick break. When we come back, I'd love to hear what the two of you have to say about SB 56. I'm Keli'i Akina with the Grassroots Institute. We're on Hawaii Together on the ThinkTech Hawaii Broadcast Network, and we'll be right back in just a moment. Welcome back to Hawaii Together. My guests today, Lisa Rantz and John Wade, medical doctor, are giving their insights into the legislature's attempt to raise taxes. And we're going to talk a little bit about SB 56 now, where the Senate passed a bill that would raise taxes on people with $200,000 income or more from 11% up to 16%, making it the highest in the nation. In addition, we would also be increasing the capital gains tax, conveyance taxes, and eliminating many of the general excise tax exemptions. Dr. Wade, so John, what do you think about this? What was your reaction when the legislature came out with this?
Frankly, from a healthcare standpoint, I think it's apocalyptic. There's a reason for that. We're already having incredible challenges recruiting and retaining physicians in the state of Hawaii. I tend to look at physicians as a canary in the coal mine. And, we're not just short of physicians, we're short of all types of other healthcare workers pretty much across the board. As initially formulated, Senate Bill 56 had much more draconian tax marginal rates, and those tax marginal rates extended down through margins into much lower ranges of income. That bill passed in that Senate by 24-1, and then crossed over to the House. The Senate did make changes to that bill, which created the 16% rate for single workers making $200,000 or more, or married couples making $400,000 or more. Those sound like high numbers until you take into account that physicians typically can leave medical school with debts that exceed $250,000, and those debts have to be serviced. The simple fact of the matter is that Hawaii is already virtually non-competitive with mainland practices for bringing physicians to this state. You need only talk to recruiters at the hospitals or many of the major healthcare entities within the state to find out that they basically are able to bring in physicians for a year or two, and the large majority of them leave. This problem has been exacerbated during a period of time when we've barely even been able to bring people in for interviews due to coronavirus. Meanwhile, the state of Hawaii has the second highest, oldest physician workforce in the country behind New Mexico. So we're experiencing accelerated retirement rates. These things in combination, the inability to recruit physicians and an accelerating retirement rate, have driven losses to this point. Now the legislature comes in and adds, a tremendous high marginal tax rate for single physicians at a relatively lower income level, that's more typical of people coming right out of fellowships and residencies, but also, married physicians at that higher level. Now, without talking about, the specifics of that income, it's just one more negative that people would have to weigh when considering coming to Hawaii. And so it makes an already bad situation worse. And so I think that Lisa would agree that, our concern is, at what point do these shortages elicit a response from the legislature? Does the statewide shortage, which is currently 30%, need to go to 40% before the legislature responds? Does it need to go to 50%? Does the Big Island shortage need to go to 70%? I think there's a significant concern that the legislature is just simply ignoring. How do you tell a young family with a 7-year-old that there just simply isn't a pediatrician out there for you to see because we simply don't have them in our state?
Right. Well, John, you are so right in terms of the negative impact that SB 56 will have on struggling younger physicians and those who have extremely high costs. And this is part of a general theme we're seeing in the state, wherein we now have one of the highest rates of exodus from our state in the entire nation, largely because of the cost of living and the cost of being able to do business. Now, Lisa, you've been tracking SB 56, and can you tell us where it's at and whether it's likely to pass? And even if it should not pass, what concerns you still have about the kind of thinking that goes into a bill like that?
Well, if I had, my magic mirror, I would be able to answer that. I think the fact that it was quadruple referred in the House by Speaker Psyche, I think bodes that it's pretty much dead on arrival. I don't think that in 2 weeks it's going to be able to pass through 3 committees. So I think that was intentional and purposeful, like Dr. Wade said earlier. We have to keep watching it because there is the chance of re-referral, that they decide that they're going to send it to just 1 committee or maybe 2 committees. So it is something that we need to keep an eye on. But, this doesn't just affect physicians. Unfortunately, this affects everyone, with the high cost of living here. And then many people don't have enough standard deductions or exemptions to bring down their income. And so, their gross income is not significantly different than their taxable income. And anyone that makes over $85,000 a year is not able to claim their interest on their loans, on their student loans. So, you just keep taking hit after hit, not to mention the federal tax as well. So if you're looking at an average rate of about 21% for your state tax, marginal rate of 32%, means between your federal and your Hawaii state taxes, each dollar over that $200,000 earned, you're paying 48 cents in taxes. So it is definitely something that all sectors have their eye on. And when you have people that have been here for generations and generations, and they're telling their children not to come back when they finish their graduate schools, or they graduate or finish residency programs, that's not okay, right? I mean, there's doctors that have been getting a hold of me since this passed the Senate, saying they're actively looking to relocate to mainland areas that have lower tax brackets where they can get a higher reimbursement rate, lower cost of living. And the whole thing is we want to raise our own and we want our kids to be able to come back, but we're pricing them out of all the markets. They can't afford the loans and to be able to provide a home for their families. It's a sad situation, and they need to do something to address it.
Absolutely. Let me go back to John for a moment. Dr. Wade, if you were to switch hats with the legislators or the governor, and you had the wherewithal to really put political power behind changing this situation, what is it that you would do? What really needs to be done by our political leaders to solve the problem of the doctor shortage here in Hawaii?
Well, I think that the economic issues that face Hawaii are larger than what faces physicians alone. Um, the current economy and its dependence on tourism is the result of a very, very long history of over reliance on a few relatively small industries in tourism. So Hawaii ends up with a very not particularly diverse economy. Hawaii also has, structural challenges in terms of the Jones Act, and it has a reluctance or even an incapacity to try and change. And so while we've been looking at targeted solutions to the healthcare shortage, which consists largely of seeking payments reform at the federal level and addressing the GET tax and its application to physicians, I think that our legislators and our governor need to look at these larger systemic issues which adversely affect the economic playing field upon which all businesses operate in the state of Hawaii. If you want to have a healthy economy and a healthy 21st century economy, then you need to look broadly at the things that you've done up to now that aren't working. You can't simply continue to do more of the bad ideas that have gotten you into this situation in the first place. So I think we need to that our political leadership needs to exercise imagination.
Very well put. Very well put. It's a much broader problem than merely a doctor shortage, and we have to address the economy. Lisa, we've got about 30 seconds. What's a closing message you'd give to the legislature?
Well, we've been in conversations for them to commission a study with Hawaii State Rural Health Association to bring in all the key stakeholders to lay out exactly what we need to do over the next 5 years to address this in a meaningful and purposeful way. So I'd encourage them to move forward with that.
Thank you very much. I want to thank my two guests today. Dr. John Wade, thank you for being with us today. Appreciate it very much. And Lisa Rantz, thank you so much. Well, you've heard it. We've got a problem here in Hawaii for all of us, not just for doctors. And it's time to speak to our legislators about some common sense in terms of both the economy and providing a good supply of medical care here in our state. I'm Keli'i Akina with the Grassroots Institute. You've been watching Hawaii Together on the ThinkTech Hawaii broadcast network. Until next time, aloha.